And we're back with more Mount Pleasant Pet Day. They're locally owned and have a brand new facility in Somerville. Here with more veterinary specialty care is Dr. Henry Bianucci along with Dr. Perry Jamieson. How are you folks doing?
Doing well. Thanks very much.
Absolutely. Now, you know, specialty care. We're talking about veterinary specialty care. You guys offer 24-hour emergency care in each location. But what makes you guys different than the other veterinarians that are out there?
What do you think, Perry?
Well, we're there 24/7, so we never close. There are holidays every weekend for emergency needs, and then we also have specialists in-house, and these are veterinarians like Dr. Bianucci is a veterinary surgeon. I'm a veterinary internist that have gone to basically 4 years of extra training and then passed certifications to become a specialist in-house. And we have a neurology, cardiology, oncology, critical care. To take care of your pet's needs that exceeds what a general practitioner can do. Kind of like if you go to your regular physician and have a problem and they send you to, say, MUSC. Exactly.
Sure. Do you need a referral with our pet to bring it in to see a specialist, one of you guys?
Well, yes and no. I mean, ultimately, it's your choice who sees your pet. And I think that, you know, the pet owning public should be aware of what's out there and what services are out there. There are many things that veterinarians, that general veterinarians can do very well, and they do it all the time. And I think that, you know, you should establish a relationship with your veterinarian and come to a clear understanding, just like you do with your doctor, of what they're comfortable doing and where a specialist comes in. And so, you know, we do the difficult, unusual things on a regular basis. And so just having that level of experience and that added training, plus having the equipment to do it, is what makes us the place to come for certain things. Now, so overall, the answer is it's somebody's choice, but we do work on a referral basis primarily. So most of, you know, the veterinarians in the community are our partners, and you know, in a professional sense, and we work with them in a hand in glove way, and they, you know, we support them. So generally, we take cases from them. But if they come in through the emergency clinic, then you know, they may need to be seen by us immediately, you know, because they're in-house and they're unstable and they need something done immediately. You know, so there's also that avenue.
So could we say that most veterinarians that are out there are basically general practitioners, like we would have a general practitioner, a family practitioner?
Yes.
And then they refer you, and they can take care of a number of things, but for specializing, like if my dog needed to have heart surgery, my veterinarian would do that, but he or she would refer that to a specialist, right?
That's correct.
Yep, that's right. Yeah, we work as an extension of their practice, really.
Dr. Jameson, you guys got some pretty exciting news at Somerville. What's
We
going
sure do,
there?
yeah. We opened the Somerville practice on Monday.
Oh, wow.
And so just recently opened, 2 days into it, and we found that there were, well, we started out in North Charleston. That was sort of centrally located hub, our first practice. And you could get there probably in 15 minutes from anywhere, back 20 years ago. Now,
20 years ago.
Exactly. Now it takes 30, 45 minutes, an hour to get there. So if your dog's seizuring or having trouble breathing, you want to be somewhere immediately. And we saw that we were getting a lot of patients from the Somerville area as it keeps expanding. And we felt there was a need, you know, for the patients and the veterinarians to be able to be there to help them.
Okay. Your location in North Charleston, where's that located?
That's on 3163 West Montague. So that's just up near the Coliseum, and that is a longest standing facility in terms of the emergency clinic. It was established there back in, what was it, 96, 97? And then we wound up coming over to Mount Pleasant. We started together started a small referral clinic, and then the emergency clinic kind of moved into that location as well. And then we wound up buying the emergency clinic, and now we really feel that the community needs that additional level of service, because, you know, it's sort of agonizing when you get a call and it's like a veterinarian in, you know, Somerville, and they're sending a dog that's got a you know, like a bloat, a GDV, which is a very time sensitive surgery, and you hear that they're on their way to you at 5 in the afternoon, and they're locked up in traffic, and this dog's really, you know, really suffering, and it can make a big difference. And so we really did feel
life
like
or
there
death
was, it is, and so we felt there was a real need for that. And the community, you know, this is obviously a very dog friendly place, and so I think we picked a good community to be in, because people love their animals here.
Dr. Jameson, real quick, you guys work with local shelters and rescues in the area as well, right?
It's very important for us to give back
Yeah.
to these animals that don't have homes. So hopefully they can be, if we can help heal them and then get them into their forever home, that's very important to us.
Doctors, thank you so very much for
Thank you,
not
Tom.
only being here, but what you're doing for the Low Country and for the animals that are out there as well.
Well, thanks so
Thank you
much.
very much.
Appreciate
Thank
it.
you.
We're going to take a brief break from the Pet Day to check out some of the great back-to-school tips right after this.